For the FBOs, CDC has worked with FBOs from the year 2001. They started working by supporting EDAP, which was started as a community facility when they were just doing community work and doing TB work. And with time, they moved on to support Coptic in the year 2004. And in 2011, we had a change in the mechanism in which we found our partners. So we used to support or fund international partners, but we changed that mechanism so that we could support our local partners, and CHAC and KCCB were lucky to be the first ones to go through that mechanism. The FBOs have done a good job. They've done a good job in terms of the HIV work that they do. For CDC, the numbers that they actually, the patients that they manage, they support approximately 30% of the CDC numbers, and nationally they support 17% of the numbers of people living with HIV in the country. So for that, I think they're doing a good job. And for the FBOs in particular, what we're working with them, the disease that we're working with them is the HIV program and trying to control the epidemic. And the reason why they were chosen is because they actually have a wider coverage geographically for the country. And there are other organizations that work with other disease programs like malaria or other communicable diseases. But for the FBOs, we're only dealing with the HIV disease. There has been a lot of significant impact in terms of actually controlling the disease. One, in terms of the prevalence has gone down, and we attribute this also just to the numbers of people being put on treatment, the management that these patients are receiving. In terms of mother-to-child transmission of HIV, the rate has gone down. The FBO transmission rate is around between 2 to 4% currently, and that is because of the work that they're doing on the ground. More now is for the partners on the ground to reorient their programs, their strategies to work with the adolescents or the young adults. And the FBOs have actually been leading in that because they already have strategies like CHAC, for instance, has a very good adolescent program, which they have been running. That's one of their best practices. Coptic has a very good disclosure program for the adolescents, and we have other partners like Kenyatta National Hospital, where they come together and share best practices. So with time, the partners on the ground or the implementing partners will actually come to tackle this problem on adolescents and the young adults. Initially, it was a challenge in the sense that not the FBOs per se, but more because they were not mainstream MOH facilities. So like, for instance, when it comes to trying to get them into the mainstream, getting their drugs through KEMSA, I mean, they needed a lot of support, getting their supplies from the lab, or their tests going to the national reference lab. They needed a lot of support and networking to be supported so that they actually go into the mainstream. So that was the challenge initially, but right now I think we've made a lot of headway, and that is why they're able to do the work that they do. As CDC, I think each partner is unique in the area that they work in the work that they do. So the work, for each, I could talk about each particular partner, but in general for all of them, I think the fact that for us, one, they cover a wide geographical region, the fact that they're able to reach many people and they have no biases, that's one. Two, they've been able to build, to support the facilities where they work through health system strengthening. That has been one of the biggest contributors that they have put in place. Capacity building for the staff in those facilities, though they have problems, challenges of high staff turnover, but then capacity building has been also one of their strengths, and those are some of the things that have actually impressed us about the FBOs. Based on where we started with them, 2001 to date, the work that they have done, the progress, and we will continue definitely working with them. We will continue fostering their relationship with the Ministry of Health, because at the end of it all, they serve the Kenyan people.